Good morning and welcome to the Community Spotlight podcast. My guest today is Christi Eckert. She is from the Marion Crawford Prevention Program. And today we are talking about, as we have in the past, the Crawford Prevention Coalition. Welcome back, Christi.
Thank you, Dave. I'm glad to be here.
Well, I'm glad to have you back. A lot of interesting things going on, aren't there, in the coalition?
Yes, there are. We're really trying to make some change in the community, and we have a lot of interesting things, projects that we've just finished and projects coming up. So a couple of the projects we just finished, in August, we had a Amplified Expressions of Our Journey event.
Okay.
And that was an opportunity where we paired individuals in recovery from substance abuse and paired them with an artist. And the artist created a story around the story they shared. So it was very powerful. A goal to reduce stigma around substance use and especially recovery, and was very hopeful. We're so excited, and it was so well received. We're going to do another one again next August, August 10th of 24. So.
And now what do you have in the pipeline?
Coming up, we just completed our Crawford Youth Rally, but in the pipeline we've got some exciting things coming to Crawford County. We are looking for actually vending machines that hold Narcan. Narcan is the life-saving drug that can reverse an opioid overdose, and those vending machines are coming to Vida hospitals. Bucyrus and Galleon will both have a Narcan vending machine outside of their emergency departments. So if someone knows someone who is struggling with substance abuse, they can go get those for free at those vending machines. And there's instructions on the box, and they can be used if they know someone who is overdosing or has overdosed.
But this is in the pipeline.
It's coming, yes.
Yeah, that's what I want to say, because I don't want people to go now.
Yes, they're not there yet, but it should be this month. So
Okay.
we're not sure the exact date. We were just told early October. As of yesterday, they were not there.
Okay.
So, but yes, should be in the month of October.
Okay, so I guess you could say somewhat subject change without notice, because you really don't know at this point.
No, not exactly.
Okay.
Yeah.
All right. I just wanted to be kind of clear on that.
Sure.
Quick response team.
Yes, our quick response team, we're really trying to get that going a little stronger in Crawford County. The concept behind the quick response team is when an individual experiences an overdose and is taken to the emergency department. If things work out right, that quick response team can be basically called and sent out to help that individual. The goal there is to connect that individual to services, to treatment, also to connect families to treatment. So the quick response team is a group of individuals. There's law enforcement, a counselor, and then a peer supporter, and that's someone who's had lived experience. That go out and they try to talk to that individual or the families, share resources, provide them with things to help them get through the process. We know that, obviously it's not an easy thing to break addiction, but it's possible, and we have many successful people in our community that have successful recovery. But we also know that families suffer too. When an individual is using substances, it can be hard on the family. So that quick response team can also provide services to the families to help them figure out how to get their individual and just to help them in general.
Christi, as you all know, there's constantly people listening to podcasts. Maybe this is the first time they've seen you on the podcast, even though that you've been a guest here before. Maybe you want to kind of give us a synopsis of what you're doing.
Sure.
and what age groups your efforts are focused upon.
Yeah. So the coalition itself, Marion Crawford Prevention Programs, we work to prevent youth substance use, period, youth substance use. So we work very closely with all the schools in the county to provide them with education programs to their students, to their staff. If their staff needs education around certain things, we provide that. We also help facilitate Teen Institute groups in all the county schools, as well as Junior Teen Institute in 8th graders, in 8th grade level. And those are peer-led prevention. So that is kids, encouraging kids to make strong choices. So we know that is evidence-based, and it's very successful and can be very successful. So we kind of help those kids to do more projects in their school and then also at the county level. We're getting ready to take probably 150 eighth graders from Marion and Crawford County to a camp at the end of the month in October. And it's an opportunity for kids just to see that there's fun to be had without using substances. There are people to support them. Maybe at home they don't see that positive, atmosphere. We also encourage them to become leaders. So we see a lot of those kids that come into the program as eighth graders that end up being strong leaders, planning and doing our larger events at that high school and senior level. So we work specifically with youth. The coalition itself, we work to educate all of those people around youth. So community members, teachers, parents, how do you support prevention? What kind of talks can you have? What kind of consequences and such? So really supporting that community to understand why prevention is important.
Okay. This also brings up something else that kind of came to mind with me is we have certain at-risk groups of people, and I hate to say that, but it's fact. There are some higher. I know addiction can be all ages, so it's hard to just pigeonhole and say it's just the group.
Sure.
But with young people, the thought that came to my mind is quite often when you deal with somebody that's quite young, because we've all been there. Believe it, at one time I was young.
Me too, Dave.
Been on quite a while back, but in youth, and I always think for adults, they really need to realize this, and when you counsel with people and you talk with them, is that they need to realize that whatever their circumstances is, it isn't going to be this way forever. Nothing is forever.
Right.
Because a lot of times if you're focused in, nothing is going to change forever, you're buying in already to something that could be destructive.
Yes. I think it's important to understand, like you said, addiction does not discriminate. It does impact any type of group, but we tend to see kids that struggle more with if they have, lack of parental or not even just parental guardianship, people engaged in their lifestyle, kids that are less involved in activities. Yes. Those are what we call protective factors. So when they have those protections, those supports to go to when they have a problem, or even just to teach them, or those peers that, guide them. Sometimes we see, maybe not the best home life, but their friends and their friends' parents are those, trusted adults in their life that they can go to if there's a struggle, or even an employer or a faith-based leader. Who knows who that trusted adult could be to them. But generally, if they don't have those supports, generally, they are at a little higher risk for use.
Well, that's something that I just thought we could talk. How did you get involved in all of
I kind of stumbled across this position. I have substance use in my family. I saw quite a lot of that growing up, and I kind of never wanted that for my family or myself. And for years, I worked at the schools and I stayed home with my children, but I just always felt passionate about helping kids. I was very, very lucky to have supports as a young person that helped show me, until my family could get into a good place, that I didn't have to choose that life. Yes. So for me, it's really a passion to provide, especially those kids at younger ages that are struggling. A lot of times we don't know. Sometimes it's very obvious, but sometimes it's not. And so trying to provide them with supports at a young age to understand what's going on, that they don't have to make that choice for themselves, and then provide supports to continue to grow in a healthy way.
And I would think as well that sometimes the resources in these homes, I'm speaking financially and whatever, it also can be a big part of this as well.
Yes.
Because, if the parents have not had a lot of success in their life, it's hard to teach something that you really haven't experienced yourself.
Yes.
It makes it very tough.
It does. And that's something to understand, that can be a cycle of a cycle.
Yes.
If we don't see, leadership or strong parenting skills, you can't expect a person to just go out and do that. They don't know any better because they haven't seen it. So, assisting in that area as well. And again, having those people that show them maybe this is, I don't want to say normal, but this is a more healthy option, or these are more healthy ways, that does help.
Well, there isn't only one way. And sometimes when you're young, you only think this is the only way it is and this is always the way it will be.
Yes.
There's no such thing.
No.
I mean, in reality, these things can change.
They can.
They can change for the better.
Mm-hmm.
Just as well as they could the other way. So
Yes.
I'm just, those are just thoughts that enter my mind as, we're having this conversation.
Mm-hmm.
The other thing I would say is a lot of times, most things nowadays, we tend to throw money at things to solve problems, but we don't, if we would spend just as much time on the relationship of building here,
Yes.
which is key, isn't it? Relationship is the key to all things.
To all things, to business, to life, to success, I think, building relationships. And you don't have to have a lot of money to do that, spending time. And sadly, our society is very much glued to social media and technology. And so I always encourage parents, have some rules around that for yourself as well. It's not just the kids, but to spend time as a family and just have conversations. It's not all about saying, drugs are not safe and this is why and this is this. It's building that relationship with your child or the child you're caring for. So if they are ever in a situation where they're confused or faced with something that they're questioning, they can come to you and say, this is something that's been presented to me. I'm really scared. What do I do? Or how do I deal with that? I think that's very important for parents to remember too. And kids are going to make mistakes. They're human.
Right.
We made mistakes. We still do. So, give them a little grace, educate, not saying that they shouldn't still have consequences, but help them out and then help them process what could I have done differently? What would have been a healthier option? What are my options if I'm in a situation that's uncomfortable?
Got to thinking also. See, my mind just keeps rolling on with these things when you mention things. Isolation. Today, it's very easy to be what I call self-isolation. Oh, yeah. You can go on, you can do all these things, you can live in your own, basically, world. Stop and think about it. You can order food and deliver it to your door, never go anywhere, and be locked into this isolation. That's not really, I don't think, a very healthy thing.
It's not. I mean, we all need human interaction. There are people that are less social than others, but like you said, we can work from home, we can get our food delivered to home, and I feel like sometimes too, when we are only living through technology, that's not really healthy, and it's not real, because we can throw, we tell our kids all the time, you can throw anything out on social media and say, my life is amazing and wonderful, but that could totally not be the case. Yes. We don't have to be honest, but when you're face to face with someone, you can tell usually if they're uncomfortable, if they're lying, or if they're struggling. And so I think it's very important. And sometimes people, and we all are in that place where we have to make ourselves be engaged. But I think for me personally, life is so much more fulfilling when we have engagement with other people, and that does protect us too, again, giving us guidance when we don't always know the answer. Being engaged with people and having those relationships are definitely a protective factor and definitely help keep us safe and healthy.
Well, I feel has been an enlightening conversation. Give people something to think about. I like people to think about things, and as I'm sure you are as well. Yeah. And anything further you'd like to add this morning before we end the podcast?
Not really. I do want to mention, if anybody is out there struggling and you think the quick response team would be a good group to talk to, the number for that is 419-564-9149. And that'll be dispersed to the team, and then they will reach out to you or your family. So utilize the services. There's a lot in our community to help, and a lot of people that want to help. So thank you.
Well, Christi Eckert, thank you from from coming over for the Marion Crawford Prevention Program. And she works a lot here in Crawford County with the Crawford Prevention Coalition. That's pretty much your main focus, correct?
Yeah.
Okay, because I always got to give all these titles, so I don't want to get it lost in the weeds. But thank you again for the work that you're doing, and hopefully we can stem some of this tide.
Let's hope so. Thanks, Dave.
Thank you very much.